Hi students, good morning. So today we are going to discuss about another interesting topic, okay, which is very short, the pulse and respiratory system, okay. So just by feeling one's pulse, we can find several respiratory disorders. So I'm going to give you a short topic that what pulse is felt and what is the diagnosis, okay. So clinically important pulses which are related to the respiratory system, okay. So generally in exam, if when you're examining the pulse, what are the points we have to say? We have to say that I'm measuring the pulse, okay, in the right radial artery. We have to say the different points, right? The rate, rhythm, character, condition of the vessel wall. Is there any radio-radial delay? Is there any radio-femoral delay? Whether all the peripheral pulses are felt equally or not, okay? So all these points should be mentioned in any pulse, okay? Rate, rhythm, character, condition of the vessel wall, how is the volume, is there any radio-radial, radio-femoral delay, whether all the peripheral pulses are felt equally, okay? Now, apart from that, now, what are the clinically important pulses which are related to the respiratory system, right? Number one, if you are getting an irregular pulse, it is a very common question in general medicine exam. Okay, where do you get an irregular pulse? What is the answer? I hope you know. It is atrial fibrillation. Atrial fibrillation, the pulse will be irregular. Okay. What is the link of atrial fibrillation to the respiratory system? You may ask a question, sir, atrial fibrillation is cardiac condition. Okay. Many respiratory conditions, especially very importantly, two respiratory conditions are very highly linked with the atrial fibrillation. In that, number one is COPD, chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease patients can present to you with the atrial fibrillation, right? So when they present to you with atrial fibrillation, then that is one of the etiology, right? One more important etiology is number second is what? Obstructive sleep apnea, OSA. Me myself, I did a research study on a polysomnography sleep study. What I found, the arrhythmias linked in OSA, okay, it was an atrial fibrillation. Many patients had got sinus tachycardia, but as a arrhythmia, which is very common, is what? Atrial fibrillation. What is the pulse in that? Irregular. Then any other respiratory condition, pulmonary embolism. Okay, pulmonary embolism can also present to sometimes with the atrial fibrillation. Okay, so three important. Think of COPD, think of OSA, think of pulmonary embolism if you are getting an irregular pulse. One MCQ. What is the most common arrhythmia in COPD? Please don't put atrial fibrillation. Most common arrhythmia in COPD is MAT, multifocal atrial tachycardia, which we'll be discussing in subsequent classes. But the atrial fibrillation will be having an irregular pulse. So atrial fibrillation is the second most common arrhythmia in COPD. Most common arrhythmia in COPD is MAT, multifocal atrial tachycardia. Fine. Followed by the first. Number two, you are getting a low volume pulse. The pulse volume is very low. What will you think of? I will be thinking of hypoxic conditions like type 1 respiratory failure. Okay, so type 1 respiratory failure comes in anywhere where there is an VQ mismatch, where there is a shunt problem. Okay, so where there is a low PO2, low oxygen, like ARDS, like a massive pulmonary embolism. Okay, so all these patients can present to you with a low volume pulse. Because of the low BP, the pulse also will be low. So low volume pulse is seen in type 1 respiratory failure. Number 3, bounding pulse. Bounding pulse is seen in which condition? The pulse will be bounding. Okay, it's seen in type 2 respiratory failure. Type 2 respiratory failure, what is the cause? It is because of CO2 retention, carbon dioxide narcosis, type 2 respiratory failure. In that, the pulse will be bounding. See, there are 3-4 important characters of type 2 respiratory failure, where examiner is again and again going to ask you this question. What are the different signs of type 2 respiratory failure? Okay, in that already in HANS and RS, I would have discussed to you what? Flapping tremor. Okay, that asterisk is flapping tremor. Okay, this one, flapping tremor. Then we have got something called as palmar erythema. Okay, then we have got an papilledema. We have discussed this in I and RS. Okay, and how the pulse is going to be? Bounding pulse. So bounding pulse, flapping tremors, palmar erythema, papilledema, all are sign of what? Type 2 respiratory failure. Okay, examiner is going to ask you this question again and again. Very important question. What are the signs of type 2 respiratory failure? Patients will be having an altered consciousness with all these things. So bounding pulse, please think of type 2 respiratory failure. Last, and which is very important, very favorite question again for examiners, pulsus paradoxus. What is pulsus paradoxus? It is also called as pulsus normalis aggregans. What is this pulsus normalis aggregans? That means it is an aggravation of the normal phenomena. Okay, what is a normal phenomena? When you are deeply inspiring, when you're inspiring like this, the systolic BP in the lower limb can fall up to 20 mm of Hg, and in upper limb can fall up to 10 mm of Hg. This is normal. It can fall up to 20 in lower, up to 10 in upper. It is normal during deep inspiration. But what is pulsus paradoxus? It is also called as pulsus normalis aggregans. What does it means? When you're taking a deep inspiration, the systolic BP in lower limb will fall more than 20 mm of Hg. In upper limb will fall then more than 10 mm of Hg. Then it is called as pulsus paradoxus. Okay. So what are the respiratory condition where will you get pulsus paradoxus? Number 1, acute exacerbation of bronchial asthma, acute severe exacerbation of bronchial asthma, acute severe exacerbation of COPD. Number 3, very important condition, tension pneumothorax. Okay, so these are the 3 respiratory conditions: acute exacerbation of BA COPD and tension pneumothorax, where you can get a pulsus paradoxus. But more in many cardiac conditions we get this, like cardiac tamponade. Okay, we get inhalation constrictive pericarditis. Okay, so but in respiratory, since I am a pulmonologist, I should restrict my talk to the lungs, don't go more in cardiac aspect. Okay, so think of pulsus paradoxus in these 2 conditions. Okay, now I have a recap about the pulse and RS again. Okay, if you're having a pulse, what are the different important things? 1 pulse and 1 answer. Irregular pulse, I will think of COPD. Second, importantly, OSA, PE, pulmonary embolism. Low volume pulse in all type 1 respiratory cases. Bounding pulse in all type 2 respiratory cases. Pulsus paradoxus, acute severe exacerbation of asthma, and I will also think in pulsus paradoxus in one more very important condition. Which condition it is? Tension pneumothorax. Hope this session is useful to you. Just by examining pulse, you can diagnose. Thank you. We'll meet you next video.